So what can we expect if we follow these guidelines? And this is a figure that shows the leisure time physical activity and the association with mortality in a large pool, what we call cohort analysis. And they use something here they call hazard ratio. And the quick explanation of hazard ratio, the hazard here is death, is mortality. And the reference group is a group that does no physical activity. So their risk or their hazard is 1. They start here. And for every incremental part of physical activity that you do in a given week, you can see this is this leisure time physical activity, not necessarily exercise. Your hazard is reduced down to around 0.6. So there's about a 40%, if you like, reduction in the hazard of mortality in a given period of time. And the nice part here is they've sort of flipped the graph on its head and how many years of life you gain. So the physical activity guidelines sit somewhere around here. So we're looking at, this is the 150 minutes, 2 days of strengthening, et cetera. And you're getting about an extra 3 to 4 years of life. Now imagine if that was a pill. Imagine if the headline in the Globe and Mail tomorrow were, drug company invents pill that extends life by 4 years. Who wouldn't want to take that? So let's focus a little bit on that 150 minutes per week. Sounds like a lot. It's 2.5 hours. And probably for some people, they would say, well, you know, that I don't know if I have the time to complete. That is 5 30-minute periods, 5 days a week, for example. And the 150 minutes per week is the aerobic activity. And we talk in this sense then about improving aerobic exercise and your fitness and heart and lung. And I'm going to phrase it within sort of the essential, I think, nature of what it means to be aerobically or cardiovascularly fit. The 4 vital signs, if you talk to your clinician, are body temperature, your pulse or your heart rate, your respiration rate, and your blood pressure. But there's been a case made that the 5th vital sign is cardiorespiratory fitness. And the reality is that cardiorespiratory fitness integrates measures from the neural level to the cardiovascular level, to the respiratory level, to the neurological level, to the skeletal muscle, to the bone, et cetera. So any weak link along that way is going to compromise your cardiovascular fitness. And the point that they're making here is that low levels of cardiovascular fitness are associated with high rates of all-cause mortality and mortality from things like established risk factors, even smoking, high blood pressure, high cholesterol, and type 2 diabetes. And so this group was making the case that we should talk about cardiorespiratory fitness or your activity patterns as a key part of your health. So probably the leading one, and most people would be able to put their finger on that. If I'm aerobically fit, my risk of heart disease is lower. I should be able to live longer and free from cardiovascular disease. And that is absolutely the case. I show a couple of these types of plots. They're called a forest plot. Anything, again, with this is an RR or a relative risk. Anything less than 1 means that you've got a lower risk than a reference group that does no physical activity or has low levels of cardiorespiratory fitness. So you can see here we've got looks like about a 15 to 17% reduction. Not bad. I'd take that. It might surprise people to know that the effects of exercise are quite wide-ranging. What can they do for a disease like cancer? Cancer doesn't appear to be restricted to heart or lungs. It appears in all kinds of tissue. And yet, when we look at people's leisure time physical activity that they engage in and their risk of 26 of the most common types of cancer in a large cohort of individuals, anybody that sits to the left of this line in terms of their hazard ratio is experiencing lower levels of cancer than people who have relatively low levels of leisure time physical activity. And the results are what we call statistically significant for, I think it's about 15 different types of cancer. So you can see them all listed here. That's not a bad deal. Again, if this were a pill, take this pill and reduce your risk for 15 of the most common cancers, 26 common cancers that people suffer from. Now, everybody's pretty sharp and they all look down the bottom here and they're like, what is this one here where I've actually got an increased risk? I'll just show you this one down here. So that's malignant melanoma. And the point there is that people who do more leisure time physical activity spend more time outside and in the sunshine, and the sun causes melanoma. So this is the portion of the program where I tell everybody to wear sunscreen. Diabetes. Type 2 diabetes is the most common type of diabetes. 90% of diabetes cases are type 2. It's estimated that probably anywhere from about 15 to 20% of Canadians have type 2 diabetes, although half that number actually know that they have it. It's the leading cause of adult blindness. It's the leading cause of adult below knee amputations. It's a disease with a very high morbidity profile. And yet again, when we look at these two figures, we're shifting down in terms of risk, in terms of your fitness. This is the cardiovascular side. But interestingly, the stronger you are as well. So this is the strengthening side of the guidelines. Again, we've got about almost a 10% reduction here and a little bit greater reduction if you're a little bit stronger. What about dementia and Alzheimer's? When I talk to the people that work out in the facility that I run here at McMaster, and I say, what are your two greatest fears as you get old in terms of your health? They say, I don't want to become a burden. My interpretation is that that means that they're losing their physical mobility and that they want to remain cognitively intact. I'm sure that probably there are lots of people on the webinar tonight who either know or have experienced somebody who goes through either dementia or Alzheimer's related dementia. Here's the good news. So I'm just going to give you, this is a fantastic graphic that this group here produced to show you if you are intact in terms of your cognitive function, what physical activity does for you here. So they've got the WHO recommendation and the odds ratio is about 0.6, so a 40% reduction. They've got being more active from, they call it unknown parameters. In other words, not the volume you do, not the intensity, not the type, but they've got a reduction down around 0.65. They've got the volume, in other words, the amount of physical activity that you do. The higher it gets, it's a dose response, is a greater reduction. They don't say anything about the intensity, so we don't know how hard you need to work out, but I'll show you a little bit of data that suggests that it's not very hard at all. The interesting part is, even if you do have a dementia or Alzheimer's related dementia diagnosis, that if you are active, physically active in terms of doing both strengthening and aerobic activities, your global cognition scores are improved, your physical performance is improved, your activity of daily living performance is improved, and probably psychological and quality of life. So even if you do have dementia or Alzheimer's, it is a benefit to be physically active. I'm just going to show you this figure, and hopefully I'll decomplicate it for you because it's pretty complex. The line you want to focus on here is the solid dark line in the middle here. And this shows relative risk. And you can see that this is the reference group, so a group that does no physical activity. And then the relative risk drops down and it sort of stays flat at about 0.75. There's a small downward trend, and it says physical activity level in MET minutes per week. Well, let's decomplicate that and say that the physical activity guidelines are here. So the reality is that the immediate decline in risk for dementia here is when you begin to do something. So it's when people go from doing nothing to doing something that they get that reduction in risk. It implies that you don't really need to do that much, which I think is a pretty poignant and significant outcome to take away. So we have what I would call evidence-based support for physical activity and higher fitness and lowering your risk and or improving your prognosis for heart disease, cancers, type 2 diabetes, Alzheimer's, and other forms of dementia, although we've got a little bit less data for other forms of dementia. And I think that in and of itself might be enough to convince most people. But this is the portion of the guidelines with which most people are familiar. I need to go for a walk. I need to get out. I need to ride a bike. I need to hike. I need to swim to improve my cardiovascular fitness. That's the big part, right? And I say it's important. It's a really big part of what you should do. So this is part of the prescription that, if I'm going to write you a prescription for exercise, I'm like, try and hit this 150 minutes or do something, get out there, go for a walk. What about the strengthening part of the guidelines? And the reality is that there's probably now a growing appreciation for people as they age to try and mitigate the effects of something called sarcopenia. Sarcopenia is the progressive age-related loss of muscle mass. Associated with that muscle mass loss is a reduction in strength. The reduction in strength and power, the ability to generate force quickly, is associated then with a reduction in physical mobility and the inability to do physical activity or activities of daily living. Most activities that we do in daily living are against very low resistance. In other words, we traditionally don't have to throw a bale of hay unless we're a farm worker. We have to pick up grocery bags. We have to walk with grocery bags, with heavy things for a little bit of time. We have to open car doors. We have to push ourselves up and get out of a chair. So these are the types of things that we're trying to mitigate with strengthening activity when we're getting a little bit older. The question is always, when does sarcopenia start? When do we lose that muscle mass? It's hard to say, but the truth is we can measure it in earnest in people in their 6th decade of life, so in their 50s. And we can detect differences as early in some individuals, particularly those that are inactive, in their 5th decade of life, so in their 40s. But this is nothing new. You can read Socrates' quote here, somewhere around 470 BC. It's a shame for a man to grow old without seeing the strength of which his or her body is capable. And this is the area of my research. And I've tried long and hard to get people to think about being stronger. And they said, well, really, it's heart disease and everything else. And that's really aerobic work. And it wasn't until some studies started coming out that were reanalyses of the sort of, I'll call it the grandfather study of all of the aerobic work that came out, called the Cooper Longitudinal Aerobic Study.